Hello, Miss Albertson. How are you doing today?
Doing good.
Good. I'm Monique. I'm going to be your nurse today.
Okay.
I'm going to do a complete head-to-toe assessment of you to check you out. So what brings you in today?
Oh, I was just having a headache.
Oh, okay. All right. Well, I'm going to wash my hands.
Okay.
I'm going to put on some gloves.
Okay.
And what would you like to be called by? What would you like to your name?
Heather would be great.
Okay,
That's
okay,
fine.
okay. I will call you Heather.
Thanks for asking.
And the importance of the assessment is just to check out all the systems, just to make sure that everything is working properly, okay?
Sounds good.
So the assessment should take anywhere between 10 to 25 minutes long, okay?
Okay.
So this head to toe is confidential. None of your information will be sent out, just within the hospital, the doctors and the team of everyone that's taking care of you. If you have any questions during the head to toe assessment, you let me know, okay?
Will do.
And I forgot to shake your hand.
Oh, okay. Good to meet you.
So right now, I'm gonna just assess your level of consciousness. Can you tell me where you're at?
I'm at UAMS.
Okay, can you give me your date of birth?
It's 6/16/80.
Okay. Also, let's see, who's the President of the United States?
It's Joe Biden.
Okay. Okay. And how is your mood today?
I'm feeling pretty good.
You feel pretty good? Okay, that's good. Can you count backwards from 100 in intervals of 10?
Sure. So 100, 90, 80, 70, 60, 50, 40, 30, 20, 10, 0.
Yes, good job. Can you pull down your mask so I can assess your facial expressions? Okay. Let's see. Do you have a remote or recent memory? Can you give me one?
Well, let's see. I had cheese grits for breakfast.
Okay. And when was the last time you had a medical checkup?
Probably August of this year.
August of this year? Okay. What was your favorite present you got for your last birthday?
Oh, goodness. I got money to go traveling.
Yes. Okay. Okay. Let's see. And I'm just looking at your vital signs.
Sure.
My tech came in and assessed you.
Yes.
Your blood pressure was 120/80, which is really good. Your heart rate was 75. Respirations were 18, and your SpO2 was 100%.
Great.
and that's within the normal range. So everything was good. Let's see. Yeah, your heart rate was, if you ran normal, you didn't run any tachycardic like you kind of were in the past, because I'm looking backwards at some previous values. It was normal sinus rhythm, which is really good. So, and your heartbeat was regular.
Awesome.
Do you have any pain?
Just a little bit in my head, but other than that, I don't have much pain.
On a scale of 1 to 10, what would you rate your pain?
Probably like a 3.
A 3. And normally, what do you take for pain?
Ibuprofen or Tylenol.
Okay. So right now, I'm going to take a look at your skin.
Okay.
I'm gonna check for any bruising, any different colorations, discolorations, my bad. Do you have any tattoos or anything? Okay. I'm gonna palpate your skin and see if there's any lesions or anything like that, okay?
Okay.
Okay. So, I'm just gonna take a look at your skin, and you're okay. It looks normal. No discoloration of the skin, no bruising.
See my legs.
Look at your legs. Okay. Alright, nothing looks out of the ordinary. I'm gonna touch the back of your head.
Sure.
To check your temp.
Mm-hmm.
Skin is warm and dry,
Okay.
so that's good. I didn't see any bumps or anything, but I'll keep checking
Sure.
throughout the whole assessment. Okay.
Sounds good.
So right now I'm going to inspect your head.
Okay.
I'm going to inspect your scalp. I'm going to look at your hair.
Okay.
Okay. Okay. So, just gonna look into your scalp. Everything looks normal, looks good. Head is normal cephalic. Both of your eyes are intact. Nose is intact. Lips are symmetrical. Head is symmetrical. Let's see. Skin looks good. Your neck, everything looks good there. Is it hurt right there?
Not too bad.
Is it tender
Just
right?
a little tender.
Is it
yeah.
tender in here too?
Right there, yeah.
Right in here.
Mm-hmm.
Okay. Do you have sinus issues normally?
Sometimes.
Okay, so pain in your paranasal sinus area.
Just a smidge.
Just a smidge. Okay. So we saw no lesions. Your scalp looked good. It was normal in color. Your hair was fine in texture, and it's straight. No parasites. Your skin was uniform in your face. Like I told you, your facial features are symmetrical. Your nose is midline. Your mouth is symmetrical. Okay. Okay, now I'm going to assess your cranial nerve 5, your trigeminal cranial nerves. So I'm gonna have you close your eyes.
Okay.
And I'm gonna touch your face lightly in different spots, maybe your forehead, maybe your chin, and you just tell me what you feel.
Okay.
Let me know when you feel that, okay?
Okay.
Okay. All right, close your eyes.
Okay.
You ready?
Mm-hmm. Now,
Okay.
forehead,
Okay.
chin,
Okay.
cheek,
Okay.
forehead.
Okay. I'm gonna just palpate around this area again. Okay. Everything feels normal. All right, you did good. You can open your eyes back up. Okay, I'm gonna have you close your mouth and clench your teeth. Okay, so once again, I'm gonna have you clench your teeth
Okay.
down and contract, and I'm gonna see if they're strong and they're equal, okay?
Okay.
So go ahead, clench your
Okay.
teeth. Yes, there we go. They are strong and they are equal. Okay. Let's see. Okay, so now I am going to assess your facial nerve, the cranial nerve 7, and make sure that it's intact and symmetrical, and see if you have any facial drooping.
Okay.
And I'm gonna, if your facial is symmetrical, no drooping, I'm gonna have you close your eyes and I'm gonna try to open them, okay? Okay, good job. Okay. So I already said that your nose was midline and no deviation. I palpated your frontal maxillary sinuses for tenderness and you let me know they were tender. That you have no occlusions in your nostrils, so things look good. Just a second. We are going to do a sniff test. This is cranial nerve 1. Okay, I apologize. First, we're gonna check for patency and have you occlude one nostril and sniff through the other. Okay, good job. And then both nerves are patent.
Mm-hmm.
See. Okay, I'm gonna assess your cranial nerve 1, which is the olfactory nerve, to make sure that it's intact. So I'm gonna have you close your eyes and smell out of each nostril individually.
Okay.
And you're gonna tell me,
Like I hold one closed,
um,
or does it matter?
yes, out of each nostril individually, and you're gonna tell me what you're
Okay.
smelling, okay? Okay. What is this?
Smells like alcohol.
Good job. All right. What is this?
Also smells like alcohol.
Good job. It's alcohol. So that's intact. Okay, I told you your lips, they were symmetrical. They are pink in color. They're moist. No cracks, no lesions. Let me use my pen light though. Can you open your mouth for me? Good job. It's pink and moist inside her mouth. Mucosa was pink. No lesions in her mouth. Your teeth were intact. Your gums are pink in color. There's no edema, no bleeding, no lesions, no retractions. Palate, no lesions. Your tonsils, they were intact. No swelling, everything looked good. Okay, I forgot to tell you that when I had you open your mouth and you said ah, that we were assessing your cranial nerve 9 and 10. Cranial nerve 9 is your glossopharyngeal and cranial nerve 10 is your vagus nerve. Your palate was symmetrical and your uvula was midline, okay? So that worked out.
Thanks.
All right, now I'm going to have you stick out your tongue. Look from side to side. Okay, everything's good. I was just checking your hypoglossal cranial nerve, and you did good. That is fine. So now that we've done that, I already assessed your eyes, but I forgot to tell you that you didn't have any drainage. There was no lesions. Your eyelashes were evenly distributed. Your upper and your lower eyelids are even. Eyebrows are present and symmetrical. Hair is coarse and color is brown. No scaliness or no lesions. You didn't have any of that. All right, stand up because we're going to do the Snell test.
Okay.
I'm assessing your cranial nerve 2, and it's the optic nerve, okay?
Okay.
So I'm going to have you cover one eye with a 3x4 card to test your right eye, and then I'll have you test your left eye. So can you...
Yeah, okay, so let's see. The smallest line I can read is EDFCZP.
Okay. Oh, you did good. All right.
Other EDFCZP.
Okay. All right.
Okay.
So thank you for taking off your glasses
yeah,
and
no problem.
and doing that for me. Thank you so much. Do you normally wear contacts and glasses or?
I usually just work with glasses.
Okay. All right. Okay, the next cranial nerves I'm going to assess is your ocular motor nerve, your trochanteric cranial nerve, and the abducens cranial nerve. So I'm just going to have you gaze out.
Okay.
All right. Things full, I guess, intact without astigmatism. I'm going to assess your pupils. And that's under cranial nerve 3, which is the ocular motor nerve. I'm going to see if they are round and reactive to light. Okay. Pupils are equal, round, and reactive to light. Let's see. So, what I'm looking for when I assess your ears is to see if they're symmetrical, to see if the tips of your ears are at the same level, if they're uniform in skin, and see if they're warm and dry. I'm trying to make sure you have no drainage or anything like that. Okay. They are warm and dry. There are no lesions. They are symmetrical. There was no drainage. I didn't see any drainage. Immediate recoil. Were they tender? Did it feel tender when I touched them? Okay, so they weren't tender. I'm gonna use my pen light to look at the outer part of your ear. Okay. All right, everything looks good. So, I'm going to test your cranial nerve 8, which is the acoustic nerve. I'm sorry, I apologize. The acoustic nerve, to see if it's intact. So what I'm going to have you do is occlude one ear, and I am going to whisper the 2-word syllabus into the other ear, okay? And I'll do it for both sides. You're gonna keep your head turned and cover the view of your mouth. So, or I'm covering the view of my mouth, which I have a mask on anyway, so that's perfect. So that you can't read my lips, okay? And I'm gonna let you know if they're intact and if you're able to hear. Is your hearing been fine? Mm-hmm. Okay, so no hearing issues. All right. Okay, so what we look for with the ophthalmoscope is we want everything to be, your disc to be yellow-orange in color and margins shaped without hemorrhages or exudate, no narrowing or AV nicking. So
okay,
that's what we're looking for with that. And I am going to assess your ears to make sure that they're symmetrical. Okay, so I'm gonna have you cover one ear and I'm gonna whisper a word into the other, okay? And have you turn your head away from me, okay? Oh, well, sorry, wrong way.
Heather.
Okay.
Heather.
All right, good job. We got it. So I just checked your cranial nerve 8, the acoustic nerve, and it was intact.
Great.
You were able to give me the 2-word syllabus, so that worked. All right. Okay, so I'm just going to check your neck and make sure it's symmetrical again. Everything is symmetrical. I palpated it. There wasn't any, I didn't feel anything that was unusual. Okay, can I have you move your neck up and down, just extension and flexion, rotation side to side. Everything is fine. And now I'm going to test your cranial nerve 11, which is the glossopharyngeal nerve. So what I'm going to have you do is shrug your shoulders, and I'm going to push down and test your resistance against me. Okay?
Okay.
Go ahead. All right. Good job. Okay, everything was fine. I didn't feel any weird lymph nodes or anything like that. All right, let me see your carotid artery. All right, pulses were strong. Strong and equal. Strong and equal pulses. Then I need to hold the bell.
Oh yeah.
Then take a listen to your carotid artery. Okay, everything looks good. Everything was equal. The rhythm was equal. I didn't hear any brutes. Okay, so when I told you that I didn't hear a brute, it basically just means that there's not an occlusion, or well, a brute would be like an occlusion of some sort. So everything was fine, everything was flowing, everything was good. I heard no like a whooshing sound. I didn't hear that. Okay, so now I am going to inspect your nail bed real quick. All right. Okay, everything looks nice. Capillary refill. It's less than 3 seconds. Your nails are nice and trimmed. There's no clubbing. Your capillary refill is less than 3 seconds. I am going to, I've done that. I am going to assess your lung sounds. I'm going to inspect your, I'm going to palpate your lung sounds. I'm going to inspect your spine to see if it's midline. Okay, so let's start with me touching and inspecting your skin and for any lesions or anything in this area. Okay. Okay. Everything feels fine. Look at your spine. Okay, everything seems good. Midline. As shaped on lateral views. I didn't see any lumps or bumps. Did it hurt? Was it tender when I touched you at all?
Mm-mm.
Okay. I'm gonna have you breathe through your mouth, and I'm gonna listen to your lung sounds.
Okay.
Everything sounded good. Bilaterally, I auscultated your lungs, interior and posterior. Lung sounds were clear. Skin tugger on your chest is good. Yep. Okay, so today we're not gonna do a full breast exam. I'm gonna talk to you about self-breast exams and what we would do if we were to do a full breast exam.
Okay.
So for the breast exam, for you checking it for yourself, we just want you to make sure you're looking for any drainage, lumps, bumps, change in size of your breast, change in size of your nipples, discoloration of your areola. Just make sure that you do that. If you see any of that, contact your doctor. Some women perform breast exams in the shower. They use mirrors and they just basically will palpate around their breasts and make sure that there's no lumps or bumps or lesions or anything of that sort.
Okay.
Or nodules, anything. If we were to have you do it today, we would just position you, probably sit either laying back, just make sure you're comfortable.
Mm-hmm.
We would probably have you put your hand behind your head and we would palpate around there, the axillary, to make sure there's no lymph nodes in your axillary area. We would palpate lateral, central, posterior, and anterior, just make sure that there's no weird lymph nodes or nodules. And we'll do it like in a wheel, like a circular motion. So, and we would look at your nipples and make sure there's not any drainage. We would squeeze them to see there's no drainage or any discharge coming out and no masses or anything of that sort. So that's really it.
Okay.